Hi, I'm Sara from Club Spirit, your menopause solution, and I'm here with the lovely Dr. Clare Searle, who is one of the UK's top menopause specialist GPs. Really lucky to be able to grab her for a chat here. So today we wanted to talk about vaginal health, don't we?
Do.
And I hear from so many of our clients that they're getting dry vagina, they're getting recurrent UTIs, they're having painful sex.
Yeah.
And what is going on with that? Like, why do we start getting all these symptoms in menopause?
Yeah, the science behind it is that the epithelium, the columnar epithelium that line the vagina and the urethra, the track up to the bladder, are both very obviously needing estrogen to support them. And as our estrogen levels fall, we start seeing changes in that and making the vaginal health less good. And as that happens, you get thinning of the walls and less sort of the walls are less protected, and so you start seeing complications, which, as you've said, are very troublesome for women.
Yeah, no, they are, absolutely. And one of the things I know you've talked about quite a lot is maybe looking at having some topical estrogen.
That's
So
right.
how does that work, and what
as
is
I
it?
say, because those cells are so estrogen sensitive, using topical estrogens can be really effective for women, to the point that actually there's a press interest at the moment about whether they might be able to become over-the-counter medicines, because they're very, very safe. There are very few people they're an unsafe medicine for, so the majority of women could use that, and it ought to make a substantive difference without all the what we call systemic effects of menopausal therapies. So you're less
Is that
likely.
when, if you're worried about too much HRT in your system?
That's
so
right.
With they're just pessaries, aren't they?
And people,
and they don't cross into the bloodstream as much.
No, they don't. And one of the things that we most commonly say is, please don't read the leaflet inside the pamphlet too much, because that patient leaflet talks very much about it being an HRT, but of course, as you rightly say, it's just topically working, and the absorption into our bodies is very low, so you can use it without really seeing the risks that you'd see in other menopausal treatments.
Yeah, I think you said somewhere else actually that it's the equivalent of taking one pill in a year or something.
It's a very small amount
so
of
it's like
estrogen.
A tiny amount that will actually go into your bloodstream.
Right. So in terms of breast cancer risk, not in the same table really as taking systemic HRT. So obviously worth thinking about.
Okay, and are lubricants generally?
Yeah, so they're underused
well?
lubricants. So I think the lubricant that's most used is KY. We try and get people to use what we call a bioadhesive lubricant, so something that's going to hold onto the cells for longer. There are a number of them on the market, but the one Silk, yes, there's a few different ones that are much more geared towards staying in place for longer.
So which ones? Those Silk and
Yes.
Yeah, Silk and Yes. Can I try some of those?
They're both really worth having.
Okay. And also for part, obviously, if you're having painful sex, you're not going to really want to have sex.
That's
and then
right.
our partners can feel very rejected and they don't really understand. So, I know it's a difficult subject to talk about, but, we want to try and explain to our partners what's going on, don't we? So they...
Well, it's no one wants to hurt somebody else on the whole. So, you find that men feel that they can't enter into the subject either. So, it sometimes is best to try and get some intimacy and some time to talk about what's going on for women.
Just to think, so that our partners understand that it's not that we're rejecting them, we're just not feeling like it,
Well, there's two different bits to feeling like it. There is, as you rightly say, pain with sex, and then there's loss of libido, and they are different, but obviously if you've got painful sex, you pretty quickly lose libido.
Yeah. Okay, so there are just a few things to think about if you are suffering from any of those symptoms. Thank you, Dr. Clare, for coming to chat about that.
That's quite all right.
And we'll see you soon. Bye.
Bye-bye.